I'm here at Direction for Living, and I have the pleasure to be interviewing Stephanie Dobbs, which is the Director of Outpatient Services and one of the key persons supervising our students here at Directions. So, Stephanie, good to have you here. Let me begin by asking you, what are the skills and characteristics that you are looking for in students applying to do their practicum or internship here at Direction for Living?
Well, we're looking for several different things. We're looking for someone who obviously has an interest in the field, who has a passion about working with our clients, who can express during our interview process that they have a basic understanding of basic counseling skills, that they will be able to do an adequate assessment, that their diagnosing skills, although will grow while they work with us, but that they come with a certain basic level of being able to diagnose the most common mental health issues and substance abuse issues, that they're able to have a basic case conceptualization skill, that they will be able to establish rapport, which will be important because otherwise their clients will not return. So we're looking for engagement skills and the ability to utilize supervision and also have a basic knowledge of risk assessment and knowing when to seek supervision, and the ability to work well with their peers in order to gain knowledge from them and also be able to impart information to their peers as well.
Interesting issue you raised about the supervision and the idea of realizing when it is crucial to seek supervision. Can you give me an example of a situation like that?
Well, an example would be if they are doing an initial assessment with a client who doesn't come out and say that they are imminently at risk of hurting themselves or someone else, but they're getting some soft signs that there may be a higher risk involved in the case. And so instead of just wanting to believe that the client will be okay, which a lot of people, to comfort themselves will think this client will be okay, to stop and seek supervision and have someone else meet with the client, talk it over with them in order to better assess the situation.
I see. Now, in your experience, okay, give me an example, without names and of course protected confidentiality, but give me an example of a good intern, somebody you remember and you go, I can't tell you the name, but I can tell you the characteristics of this person and why is it that we believe was a successful intern.
Well, I can think of several from the USF program. However, one in particular had just a huge enthusiasm for working here and working with our clients, and would go out of their way to take on challenges. If we had overbooked, clients would eagerly go ahead and meet with them, who would take on a challenge of a more challenging case and would come prepared for supervision with the case and present the issues, would be able to, she was able to present cases that she was doing very well with, as well as those that she was struggling with, who really just, I would think, went out of her way to help others and really engaged her client. She had almost no no-shows, which demonstrated a great skill at establishing rapport with her clients.
What kind of clients do you serve at Direction for Living?
Well, in our adult outpatient program, which is where the majority of the students come to do their practicum and internship, we see clients with varying degrees of seriousness of mental health issues, ranging from an adjustment disorder, depression, anxiety, moving to bipolar disorder, to trauma with PTSD symptoms, all the way to schizophrenia and schizoaffective disorder.
What are the key characteristics of new professionals applying for a job here at Direction for Living?
Well, what we are looking for in a professional counselor is a lot of the characteristics that I would look for in a student, but I look for someone who has a passion for our field, because this can be a very stressful and high-paced environment. So I'm looking for someone who wants to work with our clients, who has good diagnosing skills, good assessment skills, good engagement skills, who can work well in a team environment, who has group therapy skills, as well as individual therapy, who knows the theoretical orientation that they use in counseling and is able to demonstrate that. And it's basically someone who wants to work here and wants to work with our clients, who are fabulous clients, who a lot of times will present a lot of challenges to a new therapist.
I know you interview about 100 applicants to fill some positions here at Directions. What were some of the missing elements? What were the limitations of these new professionals that you may have observed while interviewing them?
Well, we interviewed, I think, close to 100, if not more, counselors for a program that we had just opened up. And so one of the things that had concerned me is, one of the questions I had asked was, what is your theoretical orientation and why you have that, and can you use that theoretical orientation in a specific example? And more than the vast majority, I would say close to all of them, were unable to identify a theoretical orientation to begin with. Some even asked me what I meant, and were really not able to, when I would suggest cognitive behavioral therapy, for example, were not able to use that as a real-life example of how they would use that. Another question that they didn't understand was concurrent documentation. They didn't understand that that is the industry standard at this point, and they didn't understand the words. So I think it's really important to understand the words that we use in this field, so that when you present yourself at an interview, you present yourself as a professional who knows the lingo and can participate on a professional level from day one.
What do you mean by concurrent documentation?
Well, that includes being able to document either during your session with a client or immediately following the session. And a lot of people are concerned about documenting during a session because they feel that it's taking away from their attending to the client. But we teach people that if you incorporate that into the session and end the session with a wrap-up and include the client in what you're documenting so that they can agree that those are the things you talked about, those were the important issues, and that is the plan for them moving forward, then they feel like it's part of them. It is not disrespectful. In fact, it's respectful to include them in the documentation of the session that they just had.
So when you say concurrent documentation, it includes the notes taken during the session? Mm-hmm. What else?
Well, treatment planning. So when we do treatment planning, we don't go away and decide on the treatment goals for the client. We do it with them. We make sure that we use their words and that they're really participating in the process. For me, concurrent documentation really is demonstrating that we're including the client in the process, that this is for them and not for us. And we're not doing it just to satisfy some insurance company, but really to help the client and create a roadmap for the client.
Stephanie, what are the most commonly used techniques or theoretical models in counseling clients here at the agency?
Cognitive behavioral therapy is usually the standard for most of our agencies. We incorporate solution-focused therapy techniques, especially when we're working with families. Both CBT and solution focus can be used in a brief therapy model. We have pieces of CBT, so trauma-focused CBT we use with children who've experienced trauma. Seeking safety is another CBT-based model that we use with people with PTSD and substance abuse. So really, the flavor of the month, or the gold standard at this point, is cognitive behavioral therapy and some solution-focused therapy. We are fine with using other techniques from other models, but those are our foundations.
What about motivational interviewing?
That's true. We also use motivational interviewing for any kind of behavior change to move them forward, especially with substance abuse, but with any kind of behavioral change that we're trying to work with.
And what about models like relapse prevention, for example?
Relapse prevention is used with our substance abuse clients. We run groups, and we also prepare relapse prevention plans for clients. We also use that concept with our clients with psychotic disorders to help them in their recovery process, so preparing a plan for them as well.
How interesting that part. Can you share with us just a glimpse of what may be involved in a treatment plan and a relapse prevention plan for clients affected with psychosis?
Well, what we do is we teach clients to develop reality testing techniques for themselves. So we develop support systems for them where they can check things out for themselves, and we train them to do it for themselves as well, you know, testing whether or not there are any other alternatives to the thoughts that they're having. And so what we need is we need to arm them with those skills so that they don't have to stay with us forever, that they can go forward, and they have a plan in place to do reality testing, to involve themselves with other peer support groups. We have one here, which is a peer-run recovery group that meets every day.
Are you telling me that you can use counseling interventions with persons who hear voices?
Absolutely. We try and do medication management and counseling together. Med management on its own is really not as effective. And so what these folks need is they need skills and techniques to help themselves move forward.
Thank you.
At
the count of 4. Stephanie, thank you very much. Is there anything else that I should have asked you so far, or something else that you would like to add before we adjourn today?
I would just like to add that I've been so impressed with the USF students, and they are absolutely a joy to have here. So I think it's a great relationship, and it keeps us fresh, and hopefully it gives them a learning experience that they can take forward.
Thank you so
Thank
much.
You.